is Kelbey and I want to be a peds nurse.
I'm Isabela and I want to be a PA.
Hi, I'm Mia Dodge and I want to be a mother-baby nurse.
Hi, my name is Kelbey and I want to be an ER nurse.
Imagine you walk into a hospital with pain in your upper right quadrant and you're questioning, why is that pain happening? You go up to the front desk and you get checked in and you're still in pain. You wait for about 2 hours with no help. That was me. I was in the hospital and I waited for about 2 hours for help. When I finally got in there, they ran a bunch of tests on me, and then they even brought in the psych person and told me that it was all in my head. But was it really all in my head? I don't think so. I went to the hospital in Topeka, Stormont Vale, I'm sorry. And they finally told out that my gallbladder functioning tests were extremely low and I have to get it removed.
There's so much more going on in a hospital than people realize. I mean, you have your doctor, obviously, but there's so many different levels of providers. There's mid-level and higher care providers. I, for example, want to be a PA, and that's kind of an in-between stage between nursing and being a doctor. So really, there's a whole team of people who have to communicate with each other to be able to communicate with you as the patient to get what you want. There's the nurse, there's the PAs, there's the doctors, there's the anesthesiologists, there's, administration people, surgeons. There's just so much going on. And of course, people in the pharmacy and the lab who are getting what you need. Communication in this job is super, super important because obviously it's life or death situations a lot of the times in hospitals. And that communication needs to be able to happen for the patients to be able to get their actual care. And if patients don't get their actual care, that can very easily turn into a lawsuit. And you could die. People are going into the hospitals to get better when you're sick, if they've broken something, if they just don't know what's going on, but their body isn't functioning correctly. And it's their job to properly relay that communication to their providers and for those providers to share that with everyone else that they are working with.
So in nursing school, especially nurses do a lot of different situations where they're put in groups and they have to work together and communicate effectively to take care of their patients, whether this be in a sim lab or actually in clinicals. So in simulation labs, nursing students are tasked with a patient that is in a room, and sim labs are as much like an actual hospital experience as they can be without putting the nursing student actually in the hospital. So what this is like, so they go into the room, they take care of their patient, they run through a situation that would happen in an actual hospital, and then when they're done with this, they come out of the room and they go into a debrief room. So in the debrief room, the nursing student that was in the sim lab is talking with all of their other classmates, and they're seeing what things they did well, what things they need to work on. And a lot of this relies back on public speaking. So while your video of what you were doing is playing, you're explaining what you were doing and why you were doing it. And you just tell all of your classmates what you were thinking so that you can critique each other and learn to provide the best care that you possibly can for all of your patients. So then you can learn through other students' mistakes and hopefully be the best nurses that you can when you're done with your education. Another really big part of nursing school is clinicals. So this is when you are put into the actual hospital and you're working with real life patients instead of a simulation lab patient. This is where you learn to communicate face-to-face with the patient and with other people that are in the hospital as well, like the PAs and administrative people.
So within a hospital setting, it's effective communication between your caregiver and your patient is vital to the success of the patient and also them just getting better. And this relates back to public speaking because we're taught to learn how to communicate with all different kinds of people. Sometimes when you're in distress, you're not hearing things correctly. Sometimes there might be a language barrier. So being able to communicate and hear what the patient is going through is super important to their success in getting better. And also your success as just their caregiver and that trust that you can build between patient and yourself, because when you're listening to people, all we want to do is be heard and feel like people are listening to us and understanding what's going on. So effective communication between caregiver and patients is what leads to the success of workers in the health field.
To wrap up, better communication in the healthcare field does allow for better outcomes to happen. So don't be like me and go to the hospital and think that everything that they're saying is completely true. But I seriously recommend to trust your doctors.